Well, thank you for asking me to come and talk, Bryn. And I'm going to give a very brief background about what we're doing and what the impact of COVID has been, both in terms of the impact on people's mental health, but also the impact on services. So next slide, please. Okay, so for the long-term plan, for those who don't know, you know, we got 2.3 billion extra money per year by 23-24, and that's on top of having an extra £1 billion a year for the 5-year forward view, which ran from 2016 through to next year, to April next year. Now, all sounds fantastic. You sort of think 2.3 billion, 3.3 billion. Try and remember that in 2016, when I first started this job, we had a treatment gap of in children of about 3/4 of children who had a mental health problem that you could identify in the community, a diagnosable problem. 3/4 of them were not getting any treatment. And for adults, that was just under 1 in 3. Now, I don't recall any other part of health that had that kind of treatment gap. So very important to bear that in mind when I talk about these wonderful sums of money and the additional people that we're going to see. So, you know, our long-term plan was to increase the number of people we see each year by 2 million people. And you can see in those squares in front of you the different areas that we're going to do that. So perinatal, children's mental health, developing a new service into schools. And the biggest chunk of it is going into community mental health for adults, where £1 billion a year by 23-24 will be available. So, and when I think of what that really amounts to, you know, you're talking about in Sheffield, which has got a population of 550,000, that's an extra £10 million per year on top of what we've got just going into the community. Next slide, please. So these are the things that we've achieved. We now have perinatal community teams across the country. In 2016, that was at 15%. We have moved from 1/4 of children being seen up to 36%. So we are on the way to improving that, and we're going to keep going with that. We have now got, this slide's slightly out of date, we've now got 180 mental health support teams working into schools, and we think we will exceed our target of 25% of the country being covered by 23-24. I think we will exceed that. We've also, we are now hitting nearly 90% of all children with an eating disorder under the age of 18 are being seen within 1 week if it's urgent, and within 4 weeks if it's routine. And that's getting treatment started within that time period. A&E departments, we've got every A&E department in the country now has a liaison team, and by next year, half of them, we're quite close to it, half of them will have a consultant within that team. We've set up 12 implementer sites for the community developments, and we are reviewing those. And on the basis of that review, by April of next year, we will start the national transformation program that will take 3 years to invest an extra £1 billion in community mental health. We've set up stuff in gambling, and we've also got stuff for rough sleepers. Next slide, please. Okay, so COVID. I mean, you know, it's a bit daft me telling you what the impact of COVID is. I think everybody on this call will know that. But let's sort of have a look. There's obviously been, you know, lots of people have died. That's absolutely true. We know that, you know, week by week, that a lot of people, anxiety levels, levels of depression have gone up, and nowhere is that more has that had more impact than amongst people with existing mental health problems, and you know, and that includes both common and more serious mental health problems. We're seeing people coming out of ICU who survived COVID to find that they've got two problems. That one is what's being rather strangely called long COVID, but probably much more importantly in a way is actually about 1/3 of people coming out are having PTSD. We also know that staff have had a great deal of problem, and staff working on ICU, quite large numbers are developing PTSD. There's also good evidence about rises in domestic violence during the lockdown and problems amongst kids. So kids appear to have increased difficulty of various kinds. And then, you know, on top of that, we've got to look forward to the impact of a recession that we're going to have with debt. And I can tell you, working as a homeless consultant in Sheffield, homelessness has already started to go up, as has the mental health problems that go with that and the substance misuse problems. And throughout this whole period, the consumption that the population have had of alcohol has gone up very substantially. Next slide, please. Impacts on services. If you see on that slide, the blue bit is the referrals into IAPT. They fell off a cliff. Those entering treatment is the orange line, and the grey line are those who finish treatment. Now, as you will see, I mean, this happened across all services. Referrals went down, and you know, our engagement has gone down. Now, with a lot of services, that's not quite reached full as it was pre-COVID, but we're getting there. Interestingly, what IAPT did was to go online. So 95, I think that may be in the next slide, but 95% have shifted onto shifted IAPT services to either phone, or they've gone on to video conferencing, video conferencing for therapy. And importantly, that is rising and continues to rise. So we're up at sort of 10% now are using video links, and that's growing. And you'll be pleased to know that the recovery rates in IAPT have actually improved during this time, and the sustained improvement has also improved. Now, shortly after lockdown started, the referrals into acute mental health absolutely plummeted, and although that did come back up, it took quite a while to do it. And I'm sorry to say that we had a massive improvement in out-of-area placements in the first period because you didn't need to send them out. But we are now exceeding our out-of-area placements in acute care. Next slide, please. So what else have we done to step up to this? As I say, a lot of services are now using telephone. I mean, in my own service, which is for homeless people, I'm using phones to contact people who are in supported accommodation, which has been sealed off during lockdown, so where you can't go in. But for most people, I'm continuing seeing people face to face, but with social distancing. One thing we did do was we advanced all of our programs around crisis lines. We were planning by 2022 to have every part of the country having a crisis line that you could phone 24/7. We now have achieved that already. So that was in place by May or June of this year. So that's all gone well. The children, young people, we have got our mental health support teams back up, and now kids are back at school. they're growing again. We've also published stuff on health inequalities, how to overcome that, particularly around Black and minority ethnic groups. Final thing is staff. I think on the front line have had a pretty tough time during COVID, and we've managed to get significant investment, I mean millions of pounds, to make sure that we now have hubs in every STP that will be there specifically for, as a sort of mental health service for NHS staff, and they will be able to plug into the program that already exists for doctors and dentists, the practitioner health program. So that will be opened up over the next few months. Now, it will take time to get that up and running, but we have got inward investment for that to happen. Next slide, please. Impact on delivery of national priorities. I mean, I've sort of said this already. To begin with, it's been quite hard to actually keep some of the national priorities going, not least of which was getting our mental health program into schools up and running, because that involved, rather like with IAPT, it involved us putting people into schools and then training them on the job. Well, you can't really train them on the job if all the schools are shut. But as I say, that has now got back to where we were. We've had a similar sort of problem with early intervention in psychosis and IAP. But I'm pleased to say that that's pretty much sorted out now. Next slide, please. So what are we going to do next? As everyone again on this will know, we've got 107 people dialing into this. We are now able to do stuff with online that we could have done it before, but we didn't. And Microsoft Teams and different platforms that we're using are now being used for clinical work, for team meetings, clinical team meetings, for training programs. So someone's got their microphone on and making a terrible racket. Yeah, still making a racket. The emergence of Microsoft Teams and Zoom and so on has made a major difference. Now, IAPT have done a teaching program for existing therapists so that they can train people up to do work with PTSD, but specifically for people coming out of ICU. And to do that, they've managed to do a training program with 1,800 people, all dialing in at one go. So, we're able to do things that we couldn't do before.
Tim, we need you to wind up in a minute or so. Thank you.
Okay, we wound up very quickly. So it's lots of opportunities with digital and remote working, and students, for example, can access IAPT and so on without having to, they can do that back at home. So we are going to do two things. One is we're going to drive through the long-term plan, which we think is the most important response to the mental health problems arising from COVID, alongside accelerating all the crisis stuff that we've done and consolidating our gains with distant working. So on that note, I will now finish, Alan.
Thank you, Jim. Thank you very much. It's great to hear from you. Thanks for that, setting the scene for us this afternoon. My name